Okay, I've included an extra video in Blackboard that gives you a visual of what hearing looks like, so we're just going to talk through it just a little bit. So as sound comes in, okay, it vibrates through that tympanic membrane, through those three ossicles, the malleus, the incus, and the stapes, and it causes the fluid inside the inner ear to start vibrating. So just like, if you were to be in a pool and to sort of make a little wave in the pool. So what this does is it causes calcium to be released, okay, inside that inner ear portion, which causes the neurotransmitters to be released, just like we talked about with the nervous system. And really what's happening with loud versus soft sounds is just that with loud sounds, more nerves are having action potentials, and with soft sounds, less nerves are having action potential. So it sounds louder versus softer. The nerves are going to carry, to our temporal lobes for interpretation. Some fibers do cross over, so again, we talked about this a lot, where the right side does a lot for the left does a lot for the right in the brain. When we have hearing loss, there's really two different sorts. Either what we call conductive, meaning that the sound waves can't get somewhere from the outside to the inside, or sensory neural, meaning that there's some problem with either those little sensory receptors or the nerve that's attached to the cochlea. All right, so again, watch the other video. It's about 3 minutes. It gives a really good representation of what's going on. But essentially what's happening, if you like this sort of table, is that the sound waves enter, go down that external acoustic meatus. It causes the eardrum to vibrate. Okay, those three bones, the malleus, the incus, and the stapes, also vibrate. And remember that stapes ends in the oval window. Okay, also vibrates, which causes all of that fluid, on the inside to start to vibrate. And again, different frequencies, just different levels of vibration. Either more nerves are being affected or less nerves are. All right, equilibrium also comes from your ear. So there's really two types of equilibrium. Static equilibrium, meaning do you know where you are when you're relatively still? Okay, and then dynamic is when we start to move, rotate. Can we sense that rotation and that our body's actually moving? So static refers to being still, and dynamic refers to movement. All right, when we see these, what we're really looking at are a little bit of the vestibule. And inside there we have two little organs called the utricle and the saccule. We're not going to spend a load of time with that. But we are going to look at some of those otoliths and those semicircular canals. All right, so what's really happening is that in those semicircular canals, I'm going to flip forward to a picture for a moment. Okay, what you've got are these little components of calcium that sit in those three semicircular canals. Okay, and it sits kind of in this gelatin-like substance so that for the most part it doesn't move terribly far, but when you tilt your head a little bit, right, those little stones move forward. If you were to tilt backwards, okay, those little stones move backwards. Okay, so those are your otoliths, right, because lith refers to a stone. All right, and so when they do that, there's these little hairs underneath, okay, that are going to get moved with, those little stones. So you can see in this picture here on the right, as we tip forward, those little hairs would get moved forward. If you were to tip your head backwards, your head's going to tip backwards. If you move to the right, they'll tip to the right, etc., etc. And it's really the bending of those little hair cells, okay, with that little calcium stones that sit on top that give us our positioning. All right. So there are three semicircular canals. Okay, one of them works in a forward to backwards motion. One works from a side to side, so right to left. And then one works from a top to bottom. So essentially what we're really looking at is that, are we really able to detect in all three planes, of motion? So we can really be very precise as to exactly how we're moving, whether it's side to side, up and down, forwards, backwards, and it really gives us a 3D view because of the way those three semicircular canals are set. There are some organs for equilibrium. We call them the crista ampullaris and the ampulla, and they look like little hair cells. I'm going to move forward a couple of slides for a moment. So this is one of those little hair cells that we see underneath. So we see this whole thing as the crista ampullaris. It has a bunch of little hairs in there, and they are attached to nerves. Okay, and you can see that there's 3 of them, 1 in each of the semicircular canals. So imagine this kind of like a little bit of water. If you were to take a glass of water and start spinning it in one direction, you know, kind of looks like it hollows out in the middle, and you sort of keep spinning around in one direction. And when you set the glass down for, you know, a second, the water's going to keep spinning for a little bit, and then it will sort of settle down. Well, that's exactly what's going on here. So it's kind of like when you hop on your ride at an amusement park, and it's a spinning ride. And so all of this fluid inside your inner ear is going to start to spin and spin and to move these little hair cells. Okay, and that's going to tell your body where you are in space. So when you hop off of one of those rides, okay, it often takes a minute or 2 in order to feel like you're not spinning anymore. And that's just because the fluid kind of keeps rotating. Takes a few seconds for it to stop. All right, so if we rapidly turn our head, okay, it's essentially what's going on. We call this sense proprioception, just where am I in space? Do I know where my joints are? Do I know where my body is? Okay, and that's all due to those 3 little sections inside of your ear, the semicircular canals. Just being in knowing where we are in space at all time. All right, so you can see a head in a still position. The head is rotating, and as we rotate fluid, okay, again, you can see those little cupulas at the bottom. Those little hairs just rotate. Okay, we'll tell you where you are in space. All right, our sense of sight, probably our most complex. So we're going to talk about a couple of different organs. There's a lot of accessory organs, and we'll talk about vision itself. Okay, hopefully you guys know what the eyelids are. They're there just to protect, okay, our eye from foreign objects. It is made up of a very thin skin, and it's lined with something we call the conjunctiva, which is just a mucous membrane that lies the inner surface of the eyelids, okay, and covers the very front part, okay, of the eyeball. So here is your eyelid from the side. Okay, you can see that. Okay, and the conjunctiva is this little stuff that goes right here, and it sort of stops right here, and then it lines the inside of the eyelids. Okay, so lines the inside of the eyelids, stops, okay, where the eye kind of comes out. All right, we do have lacrimal glands, fancy name for the tear ducts or the tear glands. So, of course, the purpose of tears is to rinse things out of the eyes. It does contain antibacterial properties, so that when things get into our eyeballs, we are able to tear up and wash them away. So think about if you're outside getting some smoke, right, from a campfire, okay, you're going to tear up. That's because these foreign particles are in your eyes, and your eyes are going to react by washing that away. Okay, it is also connected to your nasal portion duct. So if you're actually crying quite a bit, okay, you're going to get drainage out through the nose because it has to go somewhere. That's where it is. We do have extrinsic muscles of the eye. So there are 6 muscles in the eye, and they help to move the eye in different directions. All right, so this is a peek at your lacrimal gland. It's at the top portion of your eye. It causes the fluid to wash across your eye and gets drained out towards the inner corner and then down through the nose. All right, this is a look at the muscles of the eye, so you can see that there are 4, one that goes on the inside, one that goes on the outside, one on the top, one on the bottom, and then there are 2 that are hooked. We call those the obliques that help with eye rotation. All right, so if we look at these, right, the medial rectus is on the medial side, which is the inside of the eye, moves the eyeball in. The lateral rectus is on the outside, moves the eyeball towards an outer direction. The superior rectus is on top, okay, moves the eyeball straight up. The inferior rectus is on the bottom, okay, moves the eyeball down. You then have your 2 obliques. Your superior oblique is on top. That rotates your eye down and away, so down and towards the outside. Inferior oblique rotates up and away, okay, helping you get a nice little angle. The eye is actually fluid-filled, okay, and has 3 distinct layers. All right, so this is the front portion here. We'll talk about the front portion before this lens, and the back portion. But let's talk about our 3 layers. So the outer layer is called the cornea at the front of the eye, and it's continuous with the sclera, okay, at the for the rest of the eye. Okay, so the outer layer here at the front that kind of bulbs out, this is the cornea, and it's the continuous, okay, layer back here okay, which is the sclera. So it's the same layer, just over the front it's referred to as the cornea. All right, sclera is mostly collagen, which is a tough tissue. It's an attachment for your eye muscles, and the optic nerve comes out of the back, which is what carries vision, okay, to your brain. All right, so this is the optic nerve right here, and the optic disc is right in the center where it exits. All right, the middle layer is the choroid. Okay, so you'll see here back on this picture, okay, this little center section looks kind of pink. That is the choroid layer. All right, at the front there is the ciliary body, which is a muscle, okay, continuous with the choroid. So the ciliary bodies are these little muscles that hold this lens in place, and that lens is what's going to help focus, okay, all of the light rays that come into the eye, okay, towards the back at this little section here, which we'll talk about in a moment. All right, so here is, okay, from the front section, we will call this the pupil in a moment, but the lens is right here. Okay, we have the sclera, which is the outer white portion, and the choroid is in the center. All right, the lens is really there to help us do accommodation. Accommodation just means that as objects move, either further away, closer to you, you're able to focus them. Okay, so I mean, if you moved a pencil from arm's length closer in towards your nose, okay, that lens and those ciliary muscles are actually going to move so that you can still see that object clearly. All right, so this is what it looks like. Okay, it can either thin out the lens and the muscles pull outwards, or it can relax the muscles and the lens comes in. But what it's essentially going to do is just to make sure that whatever an object it is that you're looking for is going to be clearly focused. All right, the iris is the colored portion of the eye, and the pupil is the little black dot in the center. The iris is actually a circular set of muscles. When lights dim, okay, the pupil dilates, right? So it looks like it gets larger. When there's bright lights, the pupil should contract a little bit so that we don't get too much light into the back portion of the eye. All right, so this is what it looks like, right? So in dim light, okay, the pupil looks large, right, and the iris gets smaller. In normal light, it's about a medium size, and in very bright lights, that pupil is going to get very small, and you're going to see a lot of that iris.